Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 276 new cases of COVID-19. This brings our statewide total to 1,127 Pennsylvanians who have tested positive for COVID-19, now in 44 counties. More than 120 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first case of COVID-19. This is about 10% of the people who have tested positive. Approximately 38 of the total that have been hospitalized have required treatment in an intensive care unit, and about 18 of those have required the use of ventilators or breathing machines. 11,193 individuals have tested negative for COVID-19 to date. Tragically, we have had 11 Pennsylvanian adults die as a result of this virus, COVID-19. 2 in Allegheny County, 2 in Lackawanna County, 1 in Luzerne County, 1 in Monroe County, 1 in Montgomery County, 3 individuals in Northampton County, and 1 in Philadelphia County. I want to comment upon our healthcare system and the system capacity that we have to deal with the potential surge of patients that we expect over the next number of weeks and months. There are approximately 3,400 licensed intensive care beds in Pennsylvania. Nearly 40% are still available, but that's a number that continually changes. There are approximately 3,000 ventilators or breathing machines that are available across Pennsylvania from health systems, emergency medical services, and what are available in our storage supplies. Nearly 75% of them are still available, but again, that's a number that continually changes. Before our COVID-19 response began, we had a little over 1 million of the N95 masks in our state supply for healthcare workers and frontline responders. We have been distributing those personal protective equipment supplies and our N95 masks to hospitals and other healthcare personnel and facilities as needed. We are continuing to get more from the federal supply and purchasing whatever is available throughout Pennsylvania or the nation, or even overseas, to make sure that our response teams have sufficient supplies of these essential resources. We are also looking to industries outside of the healthcare setting that may have these supplies to see what could become available. We are actively purchasing N95 masks. We have been purchasing ventilators to contribute to our supply that we can then push out to hospitals, health systems, and other healthcare personnel. One thing that I do know for sure, however, is how important it is for people to stay home. The prevention or mitigation efforts that the governor has announced is critical to prevent a large surge of patients over the next month that could, in theory, overwhelm our healthcare system. And so please, really emphasizes the need for my message. Stay calm, stay home, and stay safe. Now here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, or the time it takes to sing happy birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face if you've touched surfaces, because that could transmit the virus COVID-19. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of this potentially deadly virus. If you have questions about your health, please contact your healthcare provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I would like to turn things over to Governor Wolf.
Thank you, Secretary Levine, and once again, thank all of you for joining us in this update. So the number of cases, as Secretary Levine said, of the novel coronavirus continues to climb in Pennsylvania. We now have more than 1,100 confirmed cases, as she said, and our hospital beds are beginning to fill up. To further our mitigation efforts, I have amended my stay-at-home order to include now Northampton and Lehigh counties. People in the counties that are already under the stay-at-home order should not leave their residences unless they absolutely must. Staying at home is vital to saving lives in our Commonwealth. If our number of COVID-19 cases continues to increase at its current rate, our hospitals will soon be overwhelmed. So we need to buy time. Time to allow hospitals to gather materials, and time to allow people who are sick now to get better and be discharged from the hospital, freeing up much-needed space and equipment. It's our responsibility, each and every one of us, to stop the spread and save lives. All of us must do our part. Many of us have already cut back on social functions and traveling. And a recent study of cell phone data places Pennsylvania at the top for social distancing. So I want to thank all of you for the sacrifices you're making. So far, much of the burden of responsibility has been borne by business owners. And over the past 2 weeks, we have been forced by the novel coronavirus to slowly unroll more restrictions on public movement. We've had to close bars and restaurants and stores because the virus quickly and easily spreads in crowds. The employees of these businesses have lost their income, and many business owners are wondering if they're going to be able to survive. That's not just bad for the owners and their staff, it's bad for all Pennsylvanians, because we need places to eat and to shop. When we get through this crisis, we're going to want to get out of our houses and go to restaurants and bars and stores, and we're going to need places for people to earn a living so they can afford to go to restaurants and bars and stores and support other workers. And so in each of us doing our part, we need to work together to preserve our businesses. I vowed to save Pennsylvanians' lives and then save their livelihoods. So my administration has already been seeking every possible source of assistance. And today I'm announcing a new source of funding that will help small businesses sustain themselves through this crisis. The COVID-19 Working Capital Access Program, or the CWCA, will provide loans of up to $100,000 to for-profit businesses with 100 or fewer full-time employees. A total of $60 million has been set aside by the Pennsylvania Industrial Development Authority for these loans. And I encourage all small businesses that have been affected by this crisis to reach out to their local certified economic development organization by phone or email. More information on CWC is available on the Department of Community and Economic Development's website. CWCA is a step in the right direction, and it's going to help provide a little peace of mind to hundreds of small business owners and their employees. But I'm not going to pretend that it's enough to cover the devastation that COVID-19 is bringing to our Commonwealth. So I will continue to develop ways to assist Pennsylvania's business community as well as our workforce. But I also need every Pennsylvanian to step up and do their part. The best way we can preserve our economic future is by minimizing the spread of COVID-19 right now. Just as any one of us can get COVID-19, any one of us can spread it. And that means we must all act as if we have it. So we must stay at home as much as possible. We must limit our contact with others. And we must practice good hygiene when we cannot avoid other people. We're going to recover from this crisis, but first we must get through it. Let's do this together. Thank you. And now I'm going to send it back to April for questions.
Thank you, Governor. Our first question is from Spotlight, PA. Can you explain the piecemeal approach to the stay-at-home order? At what point will you decide to put the entire state under the order?
Yeah, through all this, and Pennsylvania has tried to take a measured approach to this crisis. We want to buy time. And so the piecemeal approach on the stay-at-home order is based on where the outbreaks are the heaviest, like in the southeast and the counties that I've enumerated. In other areas, of course, we've done things on a statewide basis. So all the schools in Pennsylvania have been closed. The business restrictions have applied all across the state. So again, this is part of what Pennsylvania is trying to do in a measured way, but a decisive way, to make sure that we are doing no less than this crisis requires, but I also don't want to do more than the crisis requires.
Governor, from CNHI and WJAC, they both have questions about President Trump's request that he'd like to see the country starting to reopen by Easter. Do you think that will happen in Pennsylvania? And if the president recommends or declares that, will you listen or ignore the order?
I think my goal is to keep Pennsylvanians safe, and had a nice working relationship with the federal government in terms of trying to do just that here in Pennsylvania. Again, my focus is on what we have here. We need to buy the time we need here for our healthcare system in Pennsylvania with the population we have right here in Pennsylvania, and we are working diligently, decisively to do what we can to make sure that we buy the time our healthcare system needs to make sure Pennsylvanians are safe right here in this Commonwealth.
Governor, from Spotlight, PA and WNEP in Scranton, they both have questions about visitors coming over from New York and New Jersey, which are the epicenters of an outbreak closest to us. With Dr. Fauci urging residents in New York, especially to self-isolate for 2 weeks, is there anything the state can do to limit the number of people coming in from New York or ensure they self-isolate when they do?
Yeah, I think there are things that every state can do, but I think we need to be a little bit careful here. The outbreak in Pennsylvania has been spread by more than just our folks coming in for neighboring states or even people traveling domestically. So I think we have to be a little careful about how we treat our neighbors. There are a lot of people from New York and New Jersey who have homes in Pennsylvania, second homes in some cases, and who are self-isolating there. And to the extent they do the self-isolation, to the extent they stay at home, they're actually helping the situation here in Pennsylvania as well as in their home states. So we will continue to monitor the situation, but I think that the key is that what we need here for all of Pennsylvania, whoever is here in Pennsylvania, is to stay home and to stay safe and stay calm, and that applies to everybody in our state.
Secretary Levine, APC 27 would like to know that they've been hearing some from the animal rescue community that people are dropping off dogs and cats fearing that they can transmit COVID-19 to humans. Is this possible?
There is absolutely no evidence that animals such as dogs, cats, or any other domestic animals or farm animals can transmit COVID-19. There is no reason to drop animals off at rescue agencies.
And Secretary, from Center Square, why are counties with fewer numbers of cases like Erie under a stay-at-home order, say as compared to counties in the mid-state with double or triple the caseload?
So the decision for Erie County was made in a collaboration between the state and the local government and local health department. So Erie is one of the counties that has a county health department, and so in discussion with our Pennsylvania Department of Health and them, as well as the governor's office administration and PIMO with their county commissioners, a decision was made to institute the stay-at-home order in Erie County.
And then, Secretary, from Lehigh Valley Live, What specific data regarding cases or spread did you see that led to the stay-at-home order for the Lehigh Valley?
So the most recent stay-at-home orders today are in Lehigh County and Northampton County, and that decision was made because of the rise in cases, the community spread that we were seeing in those counties, and particularly the deaths that we saw in Northampton County. And so after consultation with ourselves and with PIMA and the governor's office, and then calling the county commissioners, the decision was made by the governor to institute the stay-at-home order in those counties.
And Secretary, from WTAE, to avoid a confusing diagnosis, how would an individual distinguish between allergies and early signs of COVID-19?
So the symptoms, there could be some overlap, but the symptoms are really different. Allergies, and of course it's starting to be spring, and you might have pollen and hay fever type of allergies, will give you a stuffy nose, congested nose, a runny nose, sometimes a scratchy throat, sometimes runny or scratchy eyes. COVID-19 should present differently. It is actually much more of a lower respiratory infection, and often will present with cough, sometimes a deep or heavy cough, and fever. It would be very unusual, if not impossible, to start to have a fever with allergies, but COVID-19 presents with fever and cough, and it can lead to shortness of breath and, in serious cases, difficulty breathing. It's different than allergies.
Governor, this question is for you from Penn Live. I was hoping you might respond to the Manufacturers Association's concerns surrounding what is and isn't a life-sustaining business, and how your list and the waiver process has resulted in disruption of manufacturing, medical, and other essential products by companies who have been granted waivers. Why not release the list of companies that have been granted waivers?
Actually, I'm hoping that the waiver process is helpful here. What we did was provide lists with guidance as to companies that we considered essential and non-essential, and they were very broad categories. And then consciously we set up the waiver process to say if you're a company that you feel that maybe you're being put into a category that is essential, and you're saying the Commonwealth is saying you're non-essential, we wanted to have a formal way to appeal that and to seek a waiver. And that's what the waiver process is intended to do, not to complicate things, but actually to make things work easier. So we've had thousands of waiver requests. Some of those waiver requests actually have been just to confirm that they are essential. Some have been granted the waiver to say, yeah, actually, you are someone that's doing something that is essential. We shouldn't pigeonhole you into something that maybe makes you otherwise. And we've said no to some. The idea is to apply common sense here and say the primary goal here is to buy time. We want people to keep a social distance. Stay home in those counties where we have stay-at-home orders, businesses where people would congregate unnecessarily. We want to make sure that we minimize that. But we want to do this in a common sense, again, measured way. And I think the waiver process is a way of actually trying to apply that common sense to this very difficult situation where we're trying to buy time to allow our healthcare system to ramp up to the point where they have the capacity to save the lives that we need them to save.
As a follow-up to that question, Spotlight PA would like to know how many of our waivers have been accepted, rejected, or pending, and whether or not you have to sign off on every waiver.
No, I don't sign off on every waiver. In fact, I don't sign off on any waivers. That is being done in the Department of Community and Economic Development. And as to the breakdown, it varies by day. I look at my daily staff meetings in terms of how fast we're turning things around and what the breakdown is. For the most up-to-date information, I'm going to ask Lindsay Kensinger, the press secretary, to make sure that so it's Spotlight, I think you said, is going to gets that information they need.
Thank you, Governor. And then one more question from Penn Live. Will you sign the emergency school code bill and election bill that are making their way through the General Assembly?
Yeah, the election bill is finished, and I will sign that. And I think we're moving in the right direction, in the same direction on the school code, but it keeps changing. There are different amendments that keep coming in. So I'm going to have to say I'll wait till that gets to my desk. But I think we are all trying to do the right thing here, and I'm sure that will end up in the right place.
For Secretary Levine, WPXI and Spotlight PA have questions about age breakdowns of case counts. Allegheny County is reporting age breakdowns, and they want to know if the state is considering doing the same.
Yes. So later this week, we will have an age breakdown of the cases of COVID-19 in Pennsylvania.
And then as a follow-up to that, the city of Pittsburgh, this is from the Post-Gazette secretary, the city of Pittsburgh has asked for more information about people who have tested positive for COVID-19. Is the state working to get first responders and others more detailed information about who has tested positive to give them more information before they go to a home or send someone out to work?
So we're in discussions with the city of Pittsburgh and the Allegheny County to try to provide the information to protect our excellent first responders like EMS, the police, and fire departments.
Secretary, from WNEP, what does the state plan to do to help protect EMS workers during this pandemic, as their PPE is often quite limited?
With the PPE stores that we were discussing, and we actually just have gotten some new stores of PPEs from the federal stockpile, we'll be pushing that out to the counties and to hospitals, health systems, long-term care living facilities, and EMS agencies. We want to make sure that our first responders are protected.
And then from the Tribune Review, Secretary, can you clarify dental regulations? Has anything changed today?
Nothing has changed today. We have been in discussion with the Dental Association and expert dentists throughout the state. We had put out guidance that followed the CDC guidance, but I realized that there were some challenges with that. So we're in discussions, and actually I believe I'm on a phone call tomorrow with them to just resolve that.
Secretary, from WPXI, you had said that the health department would do what it could to help with slow testing. What are you doing to help? What's your advice to medical facilities waiting 5 to 10 days for results?
So it can be very challenging. So there are a number of different ways that testing is occurring in Pennsylvania. For certain priority groups of patients, we can do our testing at our state laboratory. That would include healthcare personnel, vulnerable populations such as those that might live in a long-term care living facility, etc. And then hospitals and health systems are doing testing, and other medical providers. Many of them now have their own laboratories that are doing tests, and then many samples are going to commercial laboratories such as LabCorp and Quest. And then finally, there continue to be the mass testing sites in Philadelphia and in Montgomery County. We have heard that commercial laboratories in particular have had delays in terms of getting results back. We have spoken to some of them to try to do anything we can to help them move it along. But I know that they have some backlogs. So we'll continue to work with them to try to get test results back to the public and to patients as soon as possible.
And then as a follow-up to that, WPXI is asking some senior facilities, saying they are having trouble getting questions answered beyond the morning email update from the health department. Why is that, and what can they do to get their questions answered more quickly?
Well, we'll try to make sure that we answer their questions as quickly as possible. So I'll look into that specifically, and making sure that nursing homes and other long-term care living facilities get the answers to their questions. It's a very vulnerable population, and it's certainly a priority.
Secretary, from Wilkes-Barre-Scranton, there are many sources keeping track of worldwide cases of COVID-19, like Johns Hopkins. Sometimes the data doesn't match up with the DOH website. Could you explain the reporting process to the CDC and what factors cause the delay between local, county, and state health departments?
So the statistics that we are reporting, and we usually send out a press release at 12 noon, are the statistics that we have as of 12 midnight. And so we have to set a time that we're going to have all the data into the Department of Health, and then that's the data that we're releasing. If patients are diagnosed between midnight and in the morning, or if tragically a patient dies, then we will announce that the next day. So 12 midnight is our cutoff, and that would explain the occasional small discrepancies in terms of our data versus the county data.
Secretary, from the Associated Press, what is the internal time frame projections for when the surge of coronavirus will peak?
Well, we are continuing to see an exponential rise of cases, of new cases of COVID-19. This is being seen in Pennsylvania. This is being seen really throughout the United States and still globally. That means that we are seeing the new cases double every 2 to 3 days. And you can see that with our daily reports and the daily press conferences that I'm giving, is that the new case counts are continuing to rise. As case counts double, you can see that it's going to get very high very fast. And so the concern is that over the next number of weeks that we are going to see a surge of new cases, and thus, since approximately 10% of new cases require hospitalization, see a surge into our healthcare facilities. As we have been discussing and the governor has been reporting, we are preparing for that surge of patients. We're preparing in terms of a number of different parameters, in terms of space, making sure that we have enough beds through the whole continuum of care, intensive care beds, isolation, infectious disease beds, traditional, what I call medical surgical beds, and then actually subacute beds for patients to convalesce. For those patients, we might actually use, usually use hotels or other spaces to have people convalesce with limited medical care that they might need. In addition, we have to prepare in terms of staffing requirements, not only for physicians, but nurse practitioners, physicians' assistants, nurses, X-ray technicians, respiratory therapists for the ventilators, a whole range of different staffing requirements. And then the supplies that we have been discussing, such as the personal protective equipment and N95 masks. And then finally, crisis or emergency standards of care. So we will be working with the hospitals, the health systems, the counties, the Hospital Association for that preparation for this expected surge of patients over the next number of weeks.
Governor, the next question is for you. WTAE, WJAC, and Fox 43 have similar questions about unemployment, that there have been a large surge in people trying to get through to unemployment offices since they can't get there in person. Any suggestions for these people to get unemployment benefits? And is this making you reevaluate your order?
It's not making me reevaluate my order. Let me just move back to the point that the Secretary just made. You know, the thing that all of us are trying to avoid is an increase, a surge in disease that overwhelms our healthcare system. So we're not passive spectators here watching this curve rise. This is something we can do something about. And so to the extent that we're successful in staying home and practicing social distance, washing our hands, doing all the things Dr. Levine talked about, then that curve is not going to spike and we are not going to overwhelm the health system. So the answer to that question is conditional. It's conditional on how well we all recognize our shared responsibility in making sure that we buy the time we need. So that's I think just to push it back on all of us, 12.8 million Pennsylvanians, we can actually do something about this. Now, in terms of the unemployment compensation, as you know, with the executive order, I've waived a lot of the restrictions that typically apply to unemployment compensation, the 1 week waiting period, the liability that's assigned to employers, the additional liability because of more usage of the unemployment compensation system, and other things to streamline the unemployment compensation system. But we have had, obviously, an increase in claims that are in the hundreds of thousands. and expect those to be heavy. So what we're trying to do is to make sure that we're doing everything we can, and we have to do a better job of making sure that we make it as easy as possible to get into the system, to get the checks coming out. And we also have to make sure that, and the federal government is a partner in this, to make sure that the unemployment compensation system expands so that it's dealing with the real needs of real people right now in a gig economy, people who don't ordinarily qualify for unemployment compensation. We need to make sure that we're taking account of all those things, and I am doing that as well, in terms of what we can do here in Pennsylvania, and I'm also working with the federal government to make sure that along with other states and other governors, to make sure that we make the system as smooth, efficient as possible.
Governor, our last question is from Penn Capital Star. Are child welfare caseworkers designated as essential employees or first responders? Have they been provided personal protective gear?
Those two questions, that's a good question. I think they are essential, but that's something that Lindsay should follow up on and make sure you get the right answer on that. In terms of the protective equipment, this is an ongoing challenge, as Dr. Levine said. Our first priority is to make sure our healthcare workers, the people who are caring for the people of Pennsylvania at all ages, have the protective equipment they need. I think we don't are in a position where we can say unequivocally, yeah, we're all safe. But again, we're doing everything we can here in Pennsylvania, working with Pennsylvania sources, manufacturers, and we're working with the federal government to make sure that we do the job that we need to do to keep all essential workers safe.
Thank you, Governor. That concludes our press conference for today. For reporters that we were not able to ask your questions on air, we will follow up from the Department of Health or the Governor's press office later today. Thank you so much, and join us tomorrow for our next update.